Hi, everyone. Welcome to another episode of Dose of Pharma. My name is Talia, and I'll be your host for tonight's episode. Tonight, we have the privilege of interviewing two inspiring current pharmacy interns. Firstly, we have Mia Crigliano, who is an amazing pharmacy intern at Direct Chemist Outlet, and also a recent Monash Pharmacy graduate from last year. Secondly, we have Jarrod Ingle, an incredible hospital pharmacy intern from Austin Health, and like Mia, he is also a recent pharmacy graduate from Monash. Both Jared and Mia have built up a plethora of unique experiences, and they are more than halfway through their pharmacy internship. In tonight's episode, we're going to be exploring their journeys as pharmacy interns. We're going to be discussing the application process for internships, current experiences as an intern, and finally, just about the pharmacy intern exam, which I'm sure a lot of you have heard of. Welcome to both Mia and Jared. Thank you so much for joining us today. Really appreciate having you both here. So to start off with, we might get you both to introduce yourselves. We'll start with Jared, if that's okay.
Yeah, no worries. My name is Jarrod. My pharmacy journey started when I was 15. I started working at a local chemist in rural Victoria in Sale. And I worked there up until I left high school and went to uni to study pharmacy. Um, I then underwent a bunch of placements. One of the coolest ones was in Alice Springs, which was really amazing of Monash to fly me all the way out there for 6 weeks. Got to work in a really remote rural community, saw a lot of amazing things out there. And also went on placement to the Austin, which I now intern at.
Awesome. Thank you, Jared. Sounds like you've had a really exciting journey so far, and the placement in Alice Springs sounds really cool, and I'm sure we'll dive into that soon. And what about you, Mia? Could you give us a brief intro about yourself?
Yes, absolutely. Thanks so much, Talia, for having both Jared and I. I'm really excited to be here. My pharmacy journey started in year 11 at a careers event at school. I didn't really know what I wanted to do after high school, but I thought that pharmacy was a great blend of all my interests. And sort of like Jared, had lots of great experiences throughout uni. I was part of a few different clubs, like the Monash Parkville Student Union. I was a student ambassador, so I got to speak to lots of students, incoming and present students through peer mentoring. And I was fortunate enough to also be part of Farm Alliance, which sent me across a couple of different countries. I was really fortunate to go to the Monash Prado campus in Italy for Farm Alliance Week back in third year. And last year I went overseas to the University of North Carolina to do a 2-month research placement. And now I'm working in community pharmacy across two pharmacies, primarily at a direct chemist outlet. And I was really fortunate to, like Jared said, have some great placements and learn a lot. And I'm really excited to see where the future takes me.
Incredible. Thank you, Mia. And it sounds really interesting that you've also undertaken placements outside of Victoria. So you ventured out to all the way to North Carolina. That's absolutely amazing, as well as Prado. So, Mia, we'll start off with you. You said you're currently working at Direct Chemist Outlet mostly, but you have another day, for example, at another pharmacy. So, how did you go about getting this position, specifically at two sites as well? That's a very unique experience to have.
Yeah, so back in second year for my 1 week community pharmacy placement, I worked at an independent pharmacy or had my placement at an independent pharmacy. And a couple of weeks after that, they actually followed up and wanted to offer me a job. So I started working there once a week, and then it increased to a couple of times a week. And then towards the end of, or like middle of fourth year, I wasn't really sure what I wanted to do for my internship. I was like, oh, do I do hospital? Do I do community? I had lots of different people telling me different things. And eventually, I guess I can talk about this a bit later, but I sort of settled on community pharmacy. Um, and the owner of the pharmacy that I had that placement at and that I was working at had just recently bought another store, which is the direct chemist outlet that I work at now. And so I thought that I thought that it would be a great opportunity to sort of expand and work across both of those stores. So, like you said, I work primarily at the direct chemist outlet, and every week I'd go and do a shift at this independent pharmacy as well. And that's where I get to compound at this pharmacy as well. So I get to do a mix of things. I'm vaccinating, I'm compounding, doing some very small, like sort of consults for patients occasionally. And so I really enjoy that. So it sort of stemmed from a placement, which is really lovely. So you kind of get your foot in the door through a placement, and then it can end up taking you into internship and further. So it's always good to use placements as sometimes a bit of a job interview. So I definitely encourage younger students to make the most of their placements because you never know where it's going to take you. And I am really enjoying my internship.
That's really awesome advice. And I love the point you made about like placements as like a job interview. Like thinking of it as like a networking opportunity as well, I think is really important. Even if you don't, for example, end up working at a placement site, you never know in the future who you'll run into and who you'll meet. It could be someone that you've worked for in the past at placement. So that was great advice, Mia. Thank you so much. You mentioned, Mia, that you were tossing and turning between hospital and community towards that fourth year period. What made you go on to actually pursue community instead of hospital?
Yeah, it's a really tough question. There was really this time last year that I had like absolutely no idea. I was literally 50-50 on like what I wanted to do. And I sort of thought back onto my placements really. I guess I didn't have the standard hospital experience. I was in a couple of on my both my hospital placements. I was in two very specialized areas. I was on a like an aged care sort of section, and then like I was on the lung transplant ward. And while I really enjoyed those, I guess it didn't really give me the broad hospital experience. And I thought maybe I would want to do that, but then I also was like, I don't know if I want to be doing this job every day. I think I enjoyed the placement enough that like I enjoyed going each day, but I didn't think that I could see myself doing that for a whole year or beyond. I really enjoy the interactions that I have in community pharmacy, seeing the same people come through those doors. Like sometimes they come through multiple times a week. Sometimes you see them once a week, once a month, but you know their name, they know your name, and they want to hear how you are. You want to know how they are, and they really start to trust you to give them the advice that they need. Um, and I was thinking about also the expanding scope of pharmacists. So I knew that in community pharmacy, I was going to be able to vaccinate as an intern, and I was really excited about that. I enjoyed compounding, like I said before, so I thought this would be really great. And it's really exciting that we're having the expansion of the pilot that was 4 or 5 conditions. It's now going to 22. And I will take that opportunity as soon as I can as a pharmacist and start learning how to sort of prescribe and give advice for those conditions. And I think that's what drew me into community pharmacy, that the scope is expanding and I had lots of opportunities. And I knew that my learning wasn't just going to stop after I finish internship or studying. I can keep learning and growing.
Yeah, great. Definitely the scope is 100% expanding and can confirm Mia gave me my flu vaccine actually, and she was very good at vaccinating. So
Thanks for
definitely
that.
go to her pharmacy for that. Yeah, it is really exciting to see how the scope of community pharmacy is continuously expanding. So very excited to hear about the news and hear what you get up to in the future as well. Now for you, Jarrod, what about hospital? So you're currently a hospital intern. Did you always want to do hospital, or what was kind of your decision when it came to choosing your internship?
Well, similar to Mia, I was sort of umming and ahhing a little bit throughout my entire degree because from the start I knew that hospital was an option. And I was lucky enough to become a dispense technician at the hospital in my hometown, the Sale Hospital, over the summer for a couple of summers, 2022, 2023. And I thought that that was a really good experience. Sort of got to see the inner workings of the hospital from a sort of different perspective as a pharmacist. Still get to work with the pharmacist, even though I wasn't quite doing clinical work, but that was that was cool. And it was quite different from the community job that I still had when I would come back to Melbourne. But that being said, I also love community for exactly the same reasons that Mia says, like seeing those same people come in through that door, knowing that they trust you to give them good, solid, sound advice is really fulfilling, I think. Or even just helping someone with cold and flu in the cold and flu aisle. Like, I think that's great. And I think it's a lot of fun. And the good thing about either option is that you continue to learn either way. Like it's part of the job. It just comes with it. But I think I ended up on the hospital because of my placement. I had a great placement at the Austin, and like Mia said, it really is like a job interview, a mini job interview. You know, you sort of get to suss them out. They get to suss you out a little bit. And the best advice I have is just make an impact as much as you can. Show them that you're willing to learn and that you're passionate, and that's probably the best thing. And yeah, even some of the I worked with in that placement 2 years ago remember me now as I'm just going through my emergency department rotation. I was on that placement. I was only in the emergency department, and I had a great time. It was a lot of fun. The whole crew there was amazing. Such such valuable teachers. I learnt so much. And yeah, so that's essentially how I ended up in hospital. And also, I'd worked in community for a long time. So I was like, oh, I'll give something else a go for a bit, but you can switch at some point, and I may switch down the future, depending on what I feel like, essentially. Yeah.
Yeah, thanks, Jared. Like you brought up a lot of great points. It's definitely easy to switch between the two. I feel like a lot of students, when they go into that final fourth year and they have to make an internship decision, they're like, okay, if it's hospital, I stay in hospital for the rest of my life. But that is definitely not the case. You can switch between the two, and you can even do both, like part-time if you want. It's really up to what you make of it. And that's really cool that they remembered you from placement, Jarrod. So you must have made quite the impression as well. But I did really like what you said about the fact that you were also sussing out the places you were placed at. So it's not just about them liking you, it's also about you liking them and making sure that they're a good fit for you because it is a full-time job. So you will be there every day and you really want to make sure you enjoy it. So that's really good to know. I guess, Jarrod, in relation to that, hospital applications are notoriously known for being very, very, very competitive. I've heard a lot of fourth year students currently going through the application process. It's very stressful. All of us went through it last year. It takes a lot of energy and a lot of effort. Do you have any tips as to how you made your application stand out when it came to applying to Austin Health or any site you applied to?
Oh, that is a tricky one. In terms of tips, like you say, it is very stressful, and I was quite stressed at the time. I think I didn't end up applying to many places. I was sort of like really hoping I'd get a hospital, but I was like, oh, maybe if I don't, I can go into community. It's fine. I wasn't super fussed either way, but I think just being as relaxed as you can and putting on a smile, essentially smiling through the anxiety, and yeah, putting your best self forward to them and showing that you're willing to learn, you're passionate about it, and you know something about their hospital essentially. I think that's a really good way to do it, and I think one of the things they look for is good organizational skills as well. Is probably one of the main things. Well, that my student coordinators pointed out to me is what she really likes to see.
That's good to know. Is that stuff, I guess the values and the organizational skills, something you also highlighted in like written applications, like CV or cover letter as well?
Yeah, I definitely, before you apply anywhere, I think it's good practice to do a bit of research about where you're applying to.
Hmm.
You can tailor your CV to that essentially and speak on what the hospital itself or whichever workplace what they value as well and how you can echo those values. And I think that's a good way to go about it.
Great, thanks, Jarrod. And Mia, do you have, I guess, similar points to add to that? Do you also agree, values are very important to highlight on cover letters and CVs, or how was your process like when it came to resumes and cover letter writing?
Yeah, so I did actually apply for hospitals as well. So I did go to a couple of interviews, and I think it is I did research one of the places I applied to I had placement at, so I knew sort of what their values were, which is sort of what Jared was saying. And the other one I didn't. And so I like had a look into it, talked to some people that I knew had placements there and worked there, and just got a bit of an idea of what they might want from like a pharmacy intern. And then I decided obviously to withdraw my applications because at that point I had like decided community was for me. But then also thinking back to like times during my degree, I'd sort of one day just walked into a pharmacy. I just needed like a job and I just walked in and I was like, hey, I'm a pharmacy student. Like I live kind of nearby. Like, would you be interested in having me? And they were like, I think they were impressed by the fact that I had just kind of just walked in the door and said like I'd love a job. And like they liked the confidence, I guess. So just to be confident and like show them who you are and like that you're, going to be a great asset to their team is really important as well.
Thank you, Mia. And I guess in terms of community pharmacy applications as well, do they also require the standard like written application, CV, cover letter, like phone interview or online interview, in-person interview? Is it the same process or do you apply through a different portal or could you run us through what that's like as well?
Yeah, for me, I didn't like that wasn't, I don't think, necessary for me because I guess the owner of my pharmacy sort of just spoke to me and said, like, would you be interested in interning with us? And then I spoke to the like managers and everything, and we just had a bit of a chat. I did go into the new pharmacy that I hadn't worked at before just for a bit of an interview kind of thing, and just to see how like I would have blended in with the team and met everyone. But I think a lot of places do interviews as well, so definitely something to think about. I'm not sure about cover letters though, but I would assume probably if there is like a streamlined application for it. But again, community pharmacy internships can be a bit different. You kind of can just walk into a pharmacy, I think, and just see if they're needing an intern, and if you gel with the team, they may be happy to kind of take you on. Interns are always a really, really valuable asset to a pharmacy team because they're there every day. Like I know what's going on a lot of the time from like day to day, while a lot of the pharmacists who are only there sort of a couple of days a week don't know. And so like it's really valuable to have someone who's there and is able to understand like the day-to-day processes of the pharmacy. So interns are really valuable. And just yeah, I guess remember that as well when you're applying, that a lot of pharmacies do desire someone like an intern who's learning as well.
Definitely. And there are a lot of places that are hiring, like even if you haven't had experience working in a community pharmacy during like your pharmacy degree, that is okay. There are so many places that are hiring on like Seek, Indeed, LinkedIn. I know I've seen plenty of ads. So please like look at those job portals and you never know what you'll be able to find and use your networking connections as well. Now, my next question is for the both of you. Either one of you can chip in. Are there any skills or areas of knowledge that employers specifically look for when hiring interns? Because as an intern, your role is very clinical. So, are there some kind of skills that they already expect that you're good at before coming in? Or are they more like, no, this is your intern year, it's time to just learn and build a foundation?
I think definitely, as I mentioned before, organizational skills are really important. It is a really busy year, especially if you're doing the masters on top of working full time. Essentially, you're still at uni. Well, regardless, you're still at uni part time whilst you're working full time, whether you're doing the masters or not. And that's a lot. That's a lot for anyone. So, good organizational skills are definitely key, and at least like a baseline knowledge. Like I think Monash, I can't really speak for the other unis because I did not attend. Um, Set you up really well in terms of like your base knowledge. You can go in there, and so I don't think particularly often they didn't have huge expectations on clinical knowledge. They, like you said, were happy to help build that foundation for you, and or more so how to apply what you already know and things like that. Essentially, yeah, I think those are some of the really main points. But the more clinical knowledge you have, the better. But don't be disheartened if you don't feel like you have enough.
Yeah, that's definitely very valuable what you've said there, Jared. I think Monash does prepare you really well. Obviously, we can't speak for other universities because we didn't attend other universities, but you really just have to trust yourself and like the learning that you've been doing for the past 4 years or however long your degree is. Because it is, even though you might not retain it like every single day or practice it every single day, it is definitely stored up there 100%. So you just need to just trust yourself in that. And when it comes to interviews, like I do know I sat some clinical interviews for pharmacy internships, and I know that it can be very daunting. But at the end of the day, if you get something wrong, that's okay because intern year is a foundation year. What they're really looking for is seeing how you deal with a clinical scenario. So, how you're able to prioritize things, how you're able to communicate a plan. Do you know when to escalate to someone who is more senior or has more authority or more experience? So, looking for those soft skills essentially. Mia, did you have anything to add about this question at all?
Yeah, I think what you just said about and sort of knowing when to escalate is really important. I guess you'd sort of, especially after having worked in community pharmacy for a little bit, if that's sort of what you had done during your degree and then you go into a community internship, you would sort of hope that you'd have the basic sort of questioning skills for like OTC requests, like S2, S3 requests. And it's okay if you don't know the answer, but you kind of are able to take that information to a pharmacist and then have a conversation about what the next steps are. Or if you're getting, yeah, other requests, prescription requests, like you're seeing interactions pop up, you're able to then take that to a pharmacist and say, okay, what do I do with this information now? Or also importantly, hey, I've got this information. I think this. What do you think? So being able to look at the situation and say, like, I would do this, or like, yeah, I would think that I would do this. Like, what can you add to this? And like, how can I deal with it? It's really important. So knowing like your limits as well, I guess, because as an intern, there are certain things you can and can't do. So just being aware of that. And yeah, organizational skills definitely important because this year is pretty tough. And if you're not keeping on top of it, it's pretty easy to fall behind. But also, there's lots of support around. So that's really good to know as well.
Thanks, Mia. I really like all the points that you mentioned there. I think, yeah, very important to know when to escalate. And I really liked how you kind of formatted your answer about not knowing something, like still giving it a go, but also just leaving it open to any feedback as well. So I think it's really good when you said, oh, I think this is something that you could do, because it's not showing that you're completely giving up on finding an answer. It's showing that you are still trying. And I think that is better for your learning, 100%. So, for my next question, I was wondering if either of you had some advice to our current pharmacy students applying for internships of their own. Is there anything that you'd really encourage them to do during their pharmacy school journey in order to help them, I guess, successfully apply and obtain an internship? We'll start with Jared, if that's okay.
I think, yeah, definitely doing as much extracurricular stuff that interests you as possible. Like I was really interested in like the rural side of things, particularly the remote rural. I love traveling throughout Australia. There's so many beautiful places to see. And the good thing about pharmacy is that it can take you anywhere. There are so many options. You can locum, like particularly in the Northern Territory. I know they're always looking for people to go up there. And I had an amazing experience and probably will go back at some point in my career. And anything extra you do is always good to beef up the resume anyway. And then any other advice I would give would honestly just to be tell myself to stress less because at the end of the day, it is going to be all right. And there are so many options in pharmacy, not just in community and hospital, like outside of that. You can, this degree really can take you so many places. Yeah, that's probably the best advice I have.
Great advice. Thank you, Jared. I think we all do need to stress less, so definitely can resonate with that. Mia, what about you?
Yeah, definitely stress less for sure is such a good point. I think like especially in the fourth year OSCEs, there's a lot of pressure because like it's everything you've like learned. But at the end of the day, like Monash wants you to succeed and they want you to move on to intern year and beyond. And so like you just have to remember that they don't want you to fail and they're there to help you. And I think as well. I found great benefit towards the end of fourth year in like studying with my friends. I think I hadn't done that enough during the degree. But I found, yeah, really great benefit in like making cases for like me and my friends and like just going over content and being like, hey, this is what like I think about this. Have I missed anything? Like, what else can we add? And I'm trying to make that a bit more of a habit during intern year as well. Yeah, as well, as hard as that is, because a lot of my friends don't live super close by. But yeah, trying to find time to even pop on a Zoom call and just run through some things because like I've got friends doing internships in all sorts of places, and so we can definitely learn from each other. So I think that's definitely something that I would have liked to do more if I could go back.
Thank you so much, Mia and Jared. So our next portion will be just chatting about your pharmacy internship experience so far. So, Jared, could you run us through just a typical day for you in the wards? Like, what do you usually get up to, for example, today or any other day?
Well, it does depend what ward you're on. Like there's so many different things you can do in different wards and different workflows. But for this example, I'll use like a gen med ward. Essentially, you have to know how to prioritize. Your first priority is what I do first thing in the morning is print my bed list out, see what's changed, see who's new, mark it against yesterday's bed list. Then I'll go and do all the inpatient supplies really quickly, whilst also keeping in mind who is going to be discharged because we need to get those people out of the hospital so we can get more people into the hospital and treat them as well. So discharges are a priority. And then essentially it's admissions and queries and any other odd bits and ends that come up throughout the day. And then maybe some late discharges towards the end is sort of what it looks like. Yeah, it's sort of that's like his most general ward, which is very
Yeah.
different compared to what I do at the moment in the emergency department, where it's more like, oh, you need to pick someone who you think you can have an impact with, you know. So I'm not going to pick the 14-year-old with a broken arm who's probably not on any medications at all. I'm probably going to go and pick the 80-year-old with new diagnosis of atrial fibrillation who is already on a bunch of diabetes medications and stuff. And so all that needs to be sorted out and reconciled as well. So a bit more of choose your own adventure, but it's both are good, both are interesting.
And when you're on the wards, Jared, do you have like multiple pharmacists doing this like as well with you, or are you the sole pharmacist for the ward? How exactly does that work?
It's luckily I do have a pharmacist with me that I
Great.
can call upon for advice. They do try and get me to do as much of it myself as I can, which I think is really good. But personally, for me, the best way for me to learn is just by doing it myself. And then, yeah, being able to be like, oh, I think I should do it this way. What are your thoughts on this? And then getting advice and feedback in that way, I find really, really helpful. But it is also really nice to have that shoulder to lean on and someone experienced to call upon when you need. And sometimes it is more than one. It does depend. Like in Gen Med, there are there are six pharmacists I think across the three wards, plus me, at least one intern. And in the emergency department, there's actually also a plethora of pharmacists down there as well. So there's always someone around to help you out. And like I would always also happily ask doctors and nurses questions all the time as well. Everyone needs to work together. That's just the best way to do it.
Yeah, that's 100% true. Multidisciplinary teamwork is just the core. It needs to be done. You need to communicate with everyone in order to ensure patient safety. So definitely agree with that. Mia, could you run us through a typical day for you at either pharmacy you work at? Just what do you get up to?
Yeah, absolutely. It was really interesting to hear what Jarrod gets up to because I guess it's a whole different world. For me, it also sort of depends on the day, but like I'll have a look in the morning and see if we've got any vaccinations booked and sort of get them sort of ready. If there's COVID vaccines, maybe I'll draw them up in the morning so that they're ready to go. If it's flu, I'll just like all that you just have to attach the needle really. But we sort of get patients to fill in a form, and so then I'll have a look at that form and make sure that everything's okay for them to vaccinate. I'll do a bit of dispensing. I'll hand out like a lot of medications, especially sort of if they're new. If I'm unsure about a medication, I'll have a quick look it up and give patients the information they need, dealing with like OTC requests as well. And then when I'm at the pharmacy that I compound at, I sort of spend the whole day in the compound room, making lots of different things. So we make creams and ointments, lotions, capsules. We make troches as well, which sort of things that dissolve in the mouth. Last week I made suppositories, which is really cool as well. So getting like lots of experience doing lots of different things. And yeah, no day is the same. Answering queries from doctors as well, patients calling up about lots of different things. So yeah, it's nice that no day is exactly the same.
Sounds like both of you have very, very busy, but different days, which is really interesting. And it just shows how diverse pharmacy is. So I think that's really exciting for our listeners and viewers to hear about just that contrast. At least it was exciting for me. So that's really cool. Now, you do have really, really busy days. So could you share a highlight and a challenge that you faced in your internship thus far? And we'll start with Mia for that one.
Maybe I'll start with a challenge and I'll end with a highlight. So it definitely can be challenging on those days, I guess, where everything kind of hits you at once. Like you've got patients not like they're out the door, they've got like queries coming from everywhere. There's web pack changes that need to be done, vaccinations, like, and it's really easy to get overwhelmed. So just have to find someone, I guess, to lean on, or like multiple people to lean on, and to help you like lighten the load a little bit and realize that not everything has to be done at that moment and at that time and like by me, I guess. And a highlight has really been just seeing that kind of impact that you can make on just like even one patient's day. And it was really nice when patients started to like learn my name and they were like, "Oh, hi Mia. Like it's nice to see you." And like, "Oh, how's things going?" And I remember for my as part of your internship, you have to do a health promotion project, and mine was based on asthma. And so I was looking at some patients' asthma management, and then a week this lady came in and she was experiencing a flare of her asthma, so we were giving her like steroids to help manage that. And then a week later, she came in for a vaccination and she remembered that I was doing my internship and she asked me how it was going. And it was just really nice to know that like even the local community was like supporting me in getting my internship done and like progressing to become a pharmacist. So that was like, yeah, very rewarding and really enjoyable part of my job.
Thank you, Mia. That's really heartwarming to hear that she was like checking up on you, and it just shows how good you are at your job. So that's really lovely. And Jarrod, what about you? A highlight and a challenge about your internship thus far?
Well, like me, I think I'll start with the challenge. And I think one of the hardest things for me has been adjusting to the full-time work lifestyle. Like I work at the moment, I'm working 8 till 4:30, sometimes 5 o'clock. It sort of depends, but usually I'll get off on time, but sometimes I hang around for a bit of like exam practice with my preceptor. But just that big chunk of time taken out of the day has been a lot to adjust to, but I have adjusted to it, which is nice. That's probably been the most difficult thing, but the highlights are innumerable. I've had a fantastic time so far, seeing so many amazing different specialty wards. Like I got to have an elective rotation in the psychiatric ward, which was really cool. I have a really big passion in regards to that and helping with like the medication management and the mitigation of the side effects. As there are so many there and so many interesting and weird combinations. I really love ED at the moment. That's been really great. And I really enjoyed our manufacturing section in the hospital as well, which is sort of like compounding. I got to do some sterile compounding, like making up TPNs, making up cyclosporin infusions, iron infusions, clinical trial infusions. Lots of really cool, interesting things. And so I think, yeah, the learning aspect has been phenomenal. I just love learning about pharmacy stuff.
Well, it's really good to hear, and it's nice that you've got like so many unique experiences that the both of you are having. And it's cool that you also get electives, Jarrod. Like you can pick things that you're interested to see, and psychiatry is definitely a very fascinating field as well. You actually had a perfect segue, Jarrod, onto our next question, which is about the intern exam. So, what exactly is this exam? What is the purpose of it? And do you guys have any tips about how you've been planning or how you are preparing for this currently? We can start with Jarrod for this one.
Well, the intern exam or exams is two different exams. One, a written exam that's multi-choice, and then you have three parts to an oral exam. The best way I've found studying for it so far is just going over cases and essentially that are like provided to me by Monash. And there's a few other practice ones you can find through the people that run the exams. One is run through APRA, one's run through the Australian Pharmacy Council. And yeah, so far I've just been absolutely smashing out the practice exams. I do not know what number I'm up to now, but I think that is definitely, for me personally, is the best way that I study, is doing it that way and practicing those various clinical topics, even like, especially in a hospital setting, because there is an OTC component to the exam. You do sort of kind of lose a little bit of touch with the OTC world whilst you're in the hospital. As I found the other day doing a practice exam, I had no clue what product to choose in terms of head lice. So that was my research for the weekend, essentially, and just making a big table of every single OTC request that I could possibly get and all the possible treatment options in a big table is what I've been doing.
Sounds very productive, so that's very good. Do you get a lot of support as well from the team at Austin? So do you have like your intern preceptors who help run revision sessions? What type of mentorship do you get over there?
So each intern gets a preceptor, and all of us are expected to complete practice exams with our preceptor essentially. And our student coordinator also organises other like written practice exams for us to do, and then we sort of go through them with her as like a group, sort of sort out anything that we struggled with, anything we were unsure about. But yeah, the support is fantastic. I couldn't ask for anything better.
Awesome. That's great to hear, Jarrod. And for you, Mia, what's the support like in terms of preparing for the intern exam? What have you been doing thus far?
So, as part of DCO's like training for interns, we go once a month with all the other interns from like all the other DCO stores across Victoria, and then also on Zoom there's some interstate interns as well. So we've been running through content, and it kind of crosses between like OTC things and like legal questions, because the oral exam has three sections. The first one is an OTC component, which is like closed book, no resources, and so you sort of have to solve a problem as you would like in practice. Then part B is a legal question, which is also closed book. So you sort of have to just provide your thinking behind like a different scenario. And so talking about the legal and ethical issues that you'd come across and like provide a bit of a solution to whatever problem they've presented to you. And then part C is a bit more clinical. So trying to solve a problem, bringing the query to a doctor if you whatever issue you find, and then presenting that information back to the patient. So we've gone through all of those and then just sort of revise different topics. And we also have different suppliers coming in like every month, and they chat to us about products as well, which really helps to solidify our like understanding of like a certain topic and a certain product and why that might be useful to treat a certain condition. In terms of practice exams, they also do provide us with some practice exams, which is great. And then Monash, will also give us lots of practice exams and have given us some already. So doing all those, and then yeah, just chatting, I guess, in store. Some of the pharmacists have started to just throw random like queries at me, and they're like, this could be in the exam, like tell me what you would do. So yeah, definitely helpful. And I do work with lots of different pharmacists, and so it's nice to kind of have them all just present me with whatever problems they found during the week when I'm there or not there, and then like helping me to sort of decide how I would solve that problem.
That's awesome. And it's cool that the suppliers come in and actually teach you about that as well. It's great to hear that both of you have a really good support system in both of your respective industries. So that's nice to hear. And I think will be very reassuring for our 2026 interns to hear about. So for our final two questions, I want to start off by asking about work-life balance. We've kind of touched on it a little bit throughout this interview today, but do both of you have any final tips as to how we can, master this work-life balance between full-time work, exams, and also studying the masters as you both are at the moment? Mia, we'll start with you.
Yeah, definitely. Like Jared said, full-time work is quite a challenge. And then on top of it, you're also having to sort of go home and like study and complete all the requirements of like ITP, IFP. So it's like it definitely can be hard, but it's important to kind of find your support system and like lean on those around you for help. So I sometimes just let my preceptor know at work, like I need some time to get some of this uni stuff done. Can I just pop to the back for a bit and like just get it done, get you to sign it off for me, and then we'll be on our way. And she's like, absolutely. Let's find some time where it's a little bit quieter and like get it done. And I think it's definitely important as well to just keep in contact with like your colleagues as well, colleagues and friends. So in community, sometimes it can feel a little bit, I don't want to use the word lonely, but I am by myself. Like I am the only intern at my pharmacy. I do have another intern at the other pharmacy that I work at, and we sort of swap days, and so it's nice to be able to lean on her for help as well. She's been great. But in terms of my day to day, I am like the only intern at my pharmacy, and so just reaching out to my friends and sort of just chatting to them when I feel stressed, it helps to relieve a lot of it and makes me feel like I'm not alone, I guess. So just remembering that there are people that are here, they're really here to help and they want like us to succeed as interns. And so just, yeah, to remember that and to lean on them when we need to.
Thank you, Mia. That was lovely. And Jared, what about you?
I just want to say 100% agree with Mia. It's so important to know that you have friends and other interns that you can talk to and lean on. Like, I think, I mean, I still have lunch with all the other interns at the Austin nearly every day if we can manage it. Not always everyone gets there, but like, it's really lovely. We all sort of catch up and sort of like debrief a little bit, um, you know, get out our gripes for the day. Things like that is really, really important. But in terms of work-life balance as well, I got a really good bit of advice, I think within like the first week of internship from one of the other pharmacists, where he essentially like came up to me and it was like at an after work sort of like gathering sort of thing, being like, oh, I meet all the interns. And he said, oh, what do you do outside of work currently? And I, as many people love to rock climb. I just love it. Can't get enough of it. You can't stop me talking about it. And I said as much to him, and he was like, don't stop doing that during your internship, essentially. And don't, even though it will be hard at the start, you still need to participate in your hobbies and do the things you would normally do. Because if you put it off and stop doing it, it's so much harder to pick it back up again in the middle of the year when you're already stressed. So just making sure you have something outside of work to do. And for me, that is climbing. I love going to the climbing gym. I love going outside on the weekends. I look forward to it all the time. And I think that's really helpful. And just sort of your organizational skills coming into play again, making sure you can plan your week, being like, okay, I'm going to study this night, I'm going to climb that night, and then I go to work. I think that's probably the best way to do it.
Thank you, Jared. Yeah, from what both of you have said, very important to know that you can communicate your needs and keep in contact with your friends, family, colleagues, and also making time for your interests, such as rock climbing. That's also very cool. 100%. I guess for our last and final question, we just wanted to know if you had any advice about, we've talked about a lot of advice, I guess for the internship application process, but for our up and coming 2026 interns, so our interns next year, what advice do you have for them about tackling the intern year? Mia, we'll go with you to start off.
Yes, I think or we've sort of talked about organization a lot, but I think that's really important. I put all the dates that were like all our due dates in my calendar from the start. And so I like look at each week and I'm like, all right, I've got this due this week. I'm gonna, like Jared said, keep your hobbies as well. So you're gonna plan this day to do this and try and like stick to your schedule. And don't be afraid to ask for help when you need it. It's going to be, a big year. And everyone wants you to succeed. So just to make sure that you're looking out for yourself, and when you need some help, or if you need, I know in hospitals you can get sort of I think you might get some time off, like a day off every month or once in a while. Just make use of those days, make use of that time, make use of the people around you, and just know that at the end there is like light at the end of the tunnel, and it might be difficult, but it's nearly done. We are nearly done, and it's honestly flown by, and I know that I'm probably going to miss some aspects of my internship once it's finished, and just, yeah, I guess making the most of the opportunities that you've got and the people around you.
Thank you, Mia. And Jarrod, lastly?
Yeah, definitely want to echo everything that Mia's just said. And I think just the main thing to do is just give it your best shot. Like, it is a year to learn, and it is okay to fail essentially. And yeah, just give it your best shot, I think is all you can really do.
Perfect. Thank you both for that advice. That was really lovely to hear. And thank you for sharing like personal anecdotes about your experiences. We really do appreciate your time today. So today we've learnt so many different things. We've talked about a lot of things. We've spoken about the application process, the importance of really showing and learning hospital and community values. We've talked about the importance of confidence and even using placements as a little job interview or networking opportunity. We've discussed the importance of organizational skills and how key they really are, and how you will get that opportunity to develop them as well during your intern year. We've talked about work-life balance and how important it is, and if you really do prioritize time for yourself and communicate your needs and keep your best interests at heart, it is possible. And I think the most important message that I've gotten out of today as well is that everyone wants you to succeed. I think that's a really important message to remember. And with that final statement, I just wanted to thank Mia and Jarrod for coming on tonight and for speaking to us here at Dose of Pharma. We really do appreciate your time, and we're excited to hear where you go with your pharmacy journeys. So keep in touch. And best of luck to our up and coming interns, so those applying this year for internship next year, and those interns in the future. We really hope that this episode was helpful and that everything goes extremely well. Have a lovely night, both of you, and thank you so much to everyone listening and watching. Take care.
Dose of Pharma acknowledges the traditional custodians of the various lands throughout Australia on which we connect today, and pays respect to elders past, present, and future.